One word keeps popping up: peptides.
This is the newest thing that I've included into my routine.
These two peptides have changed my life.
I've used them myself and used them with really good effect.
How do you really invest well into your health?
I've had men that are on the brink of divorce come in, get their hormones balanced, start feeling great, their marriages improve.
What were some of the things that people were saying about these types of therapies that are just not true?
With this boom of peptides, they work, they're safe, but at the same time, getting them online, not smart. But this is my peptide act.
Welcome into the Invest Well show. Listen, today we're talking about wellness, all around wellness for you guys out there and girls. It's so important. There's a lot of information that you're hearing online, on TikTok, on Instagram, all over the place. Take this, do this. How do you do it well? The question is, how do you really invest well into your health? Obviously, you guys know the show's powered by Wall Private Wealth. I have several financial companies helping families. Our team helps families with really protection, growing, and reducing taxes on their wealth in many ways. But I wanted to have a conversation today with not only a good friend, but also Dr. Phil, the other Dr. Phil Scuderi. He's got a great company, really chiropractic, physical therapy, all around wellness, Basis Medical. You've probably seen them around. They're in Delray. They're here in Gardens and then go by a different name, but in Stewart as well. Phil, you and I have been friends for quite some time. And, it's interesting. We shared an office. We had, had a lot of conversations just in general, growing a relationship. But I've watched you over the years, and you're not only attention to detail and how you run your business, but also really excellence in ensuring that you guys can provide services that are coming alongside, families, men, women, to kind of maximize their health and output in general. And I wanted to have you on because I really want to be able to share with the audience some things that matter, because I think there's a lot of information out there shared by a lot of people that might look the part, play the part, but don't really have the experience. You've been in this space over 20 years. That's a long time. You've done a great job in this. So first, let me just say thanks for taking a minute and joining us on the show.
Thank you for inviting me. I appreciate it.
Yeah, it's gonna be good. So let's jump into it. Let's start with background, right? Everybody's got a history. Like, what kind of led you into this space? Obviously, chiropractic, physical therapy, now general overall wellness. Like, how did you get into this space? What kind of led you to kind of say, there's a problem here, I need to fix this?
Yeah, no, great question. So I actually started out when I was very much, when I was younger, I wanted to be an MD, a medical doctor. I grew up in Emerald Hill, South Florida, a lot of doctors and lawyers in the neighborhood, a lot of different family physicians, dentists. So anyway, I want to be an MD. Pre-med at FSU, okay? We're cutting up animals, all the grossest stuff. I was like, I hate this. Like, what, I don't want to do this. So I switched to nutrition, which I was very much interested in. And I was working out a lot. So I knew the importance of having a healthy body, the importance of eating correctly. And I want to be a doctor. Well, I segued right into chiropractic. It was great. So graduated, went to Life University in Atlanta, and became a chiropractor. One of the things I always knew about chiropractic, which was cool, was that you could be a multidiscipline chiropractor. So chiropractor isn't just like adjusting the spine. You're treating the whole body's health. So for example, let's say a guy comes in and he's 50 pounds overweight, he's got back pain. Instead of just treating his back, it's like, dude, you need to lose weight. Matter of fact, you need to strengthen your core. We got to change things. So I started out like doing, let's say, the tradition.
And were you always, Phil, let me ask you this. Were you always of that mindset?
Yes.
Like kind of total body vibe?
Absolutely.
Yeah.
Probably had more of like an insurance-based practice in the beginning, meaning, we would check their insurance benefits. They would do physical therapy, chiropractic. But over time, like it definitely segued to like anti-aging, multidisciplinary, looking at the whole body. And then I came up with this concept once we started bringing aesthetics in. I was like, can we get a patient to look and feel 10 years younger? So it wasn't just about like adjusting their spine or getting them stronger. It was about, balancing their hormones, looking at their overall health and just, helping them lose weight, getting them on a training program, helping them making decisions with eating and things like that. So just their overall health.
And where did you first launch? Your first office was where?
It was in Palm Beach Gardens, right at the North Lincoln Military, kind of across where we are now.
Yeah.
For 20 years.
And when did you, then you have a place in Delray and obviously another name in Stewart, but like when did those launches occur? How did that happen?
About 10 years ago, we moved down to Delray, built a building down there, have a gym, had a real wellness center. And then a few years ago with a partner up in Stewart, opened up a chiropractic PT center out of a 25,000 square foot gym, a really cool, raw athletic club, my boy Dom. And it's been really neat doing that too.
That's awesome. So let me ask you this question. What would you say, because especially with the internet today, right? I mean, people are on social media, they see all these things that you're watching. Everybody's an influencer, and they, even with AI now, gosh, I was sending something to Leo, our producer, the other day, And I was like, look at this guy. It's really cool. He's like, dude, that's all AI,
True.
So, I mean, there's so much information out there. It's like, hey, do this and you're going to be, take 10 years of age, look off your age, all this kind of stuff. What do you see a lot of times when people are coming in? Now, I mean, is there a lot of misconception maybe out there of what they're hearing versus what is actual reality as far as their health?
Great question. So the good news is there are a lot of options out there based on what used to be available, which is like more of a medical, oversight, let's say. You go see your primary care and there weren't really many options about getting prescriptions to help you. Hormone replacement therapy used to be like, oh, it's bad for you, it causes cancer. So there's been a major shift to like, first off, it doesn't cause cancer, it can actually prevent cancer, for men and women. But now with this boom of peptides, they work, they're safe, they're effective. But at the same time, getting them online, not smart. And we can talk about the differences of getting them done the correct way. But no, the good thing is peptides now to help you like lose weight. You got peptides for your hair and skin to help you lose fat, to put on muscle. I mean, for almost everything. It's amazing, and they do work.
So let's break down and go back what you said there as far as hormone replacement therapy. And you guys have actually helped me with that. Surprisingly enough, I don't know. You guys have seen me over the years. I'm in a situation where I'm kind of like the Energizer Buddy in a lot of ways. And I was surprised to know, and you were even like, gosh, I couldn't believe it. Like I got my levels done and I was like close to 300. I was like, wow, this is low, right? It shouldn't be that way. It was low. Still had energy and stuff, but just overall, there was some aspects of my life. I was like, what? I got to be able to kind of jump in a little bit more. So it's interesting, obviously, and I'm aging myself here for a minute, and I'll let you know I'm 48 years old as we're shooting this in 2026. Phil, it's interesting to me when I look at these things, it's like, a lot of times as we age, quite honestly, our bodies just don't continue to produce. It's not a negative or positive. Years ago, 20, 30 years ago, correct me if I'm wrong, people were in a situation where they just kind of accepted their aging process, right? And now, because technology has changed, because of research has changed, they're coming out with things that are more natural in general, that our bodies would produce itself. And so we have the ability to kind of do things we didn't maybe do over the years. I think you have to have balance. You don't want to just do it just to kind of be He-Man again, like you were in 22, but you also want to be in a situation where you have balance so you can live a full life. So let's talk about, you talk about hormone replacement therapy, HRT. What is, you hear guys like Gary Brecka talking about this, you hear other people talking about this, and sometimes be like, where do you go to get this stuff? But what has been, in your opinion, the biggest, you said about people saying it's causing cancer. Where does all that come from? What were some of the things that people were saying about these types of therapies that are just not true?
Well, you bring up a good thing about, how about this? Like back in the 80s, a lot of the actors that we saw on certain shows like Archie Bunker and the Dukes of Hazzard, whatever the dad's name, they were like in their 50s.
Yeah.
They were like, they're old men. No, they were in their 50s. So yeah, it has changed. So now
it really is crazy.
It is crazy.
I mean, you think about like 50s, 60s back in the day, it's like, wow, that's
super old. And guess what? You're not just, you're middle age in your 50s. Let's face it. You should look good. So yeah, you're exactly, I mean, you are a great example of like a 40-year-old guy. When I met you, man, like literally major energy. Like I was like, this guy's, I mean, what is he on? Well, he's on life. He's just got this super energy, but you're in your 40s. And then when you came in to get your blood work tested, it's like, yeah, there's some things that are lower. We call them suboptimal. So to be clinically like low for a test for testosterone as a man, it's between 300 and 1200 or 1000 range. So the range is,
so let's slow that down for a minute. So the range is, for those that are watching that don't understand this, okay? So let's say somebody's a guy, 30s, I mean, it could be 20. Just, everybody's different, right? But the ranges for men are what?
Okay, roughly 300 to, let's say, 1,000. Because sometimes it goes to 1,200, some goes to 900. It's about 1,000. Okay. 300 to 1,000 is considered normal. So if you're 30 years old and you're in the 300s, most primary care doctors say, yeah, you're normal. You're within normal limits. We call that massively suboptimal. Okay, 40-year-old, same thing. 50-year-old. We're seeing, it's like an epidemic, if you want to know the truth. 40s, 30s, almost everybody has.
Why do you think that is? I mean, is it the food? Is it the nutrients that we're getting? Where do you think it's coming from?
I think
what's the core?
I think it's all of it. In other words,
the technology, Wi-Fi, 5G, all the stuff. I mean, I don't know. I'm asking.
Yeah. No, it's great. It's great because look at what we're eating. Look at what's now coming out. That how many toxins are in our foods. Like RFK came in. He's done some really good things. They flipped the food pyramid. So our waters have toxins in them, fluorides and things that we don't even necessarily need. Stress level is higher than, I don't know why, but like looking at your phone all the time, not getting good sleep. Obviously, like I said, the toxins that are in our foods, medications, drugs that are just easily prescribed. Oh, you're a little bit depressed here, take this. Oh, your blood pressure is high, take this. So these things aren't helping, our bodies like function normally. And so for some reason, our testosterone levels are going down. Women's testosterone, estrogen levels are declining, and it's like a real problem.
It's a big problem. I think what it is it is a result. This is my opinion. It's a result of years and years of the medical profession essentially being in a situation where they are prescribing Band-Aids to problems instead of just providing solutions. I can't, it's interesting. I've been in the financial industry about 26 years now, different companies, commentated for national media for 6 years, did a bunch of different things. And it's amazing to me when you look at the machine, whether it's in the financial industry or in the health industry, the goal is really just to create noise. To create noise so people are confused, they don't really know where to go, they don't really know the questions to ask. The internet has really opened up a lot of opportunity for people to do research on their own in many ways. Obviously, one of the challenges is you can chat GTP or Grok or whatever something, and you got to make sure, like, where is this information really coming from, and can I trust it? But there's good and bad to everything, but it's given people the ability to research things. Phil, just as an example, like when babies, vaccines, and we have autism and all this stuff, people are like, whoa. For years, they're like, no, you have to do this. But now people are like, wait, time out. So I think the pendulum has shifted, like you said, in many ways, and it's caused people to say, I need to be actively focused on my health. I think that's a positive. So when people come in, run us through a scenario as an example. What are you typically seeing today? Obviously levels are low. How do we solve some of that problem?
Okay, great question, because the number one symptom for men and women is just low energy, mental fatigue. It's not decreased strength or the libido is off. Those are affected too, but literally it's just, I feel tired all day. I can't get my edge back. It's just that feeling of just not having that oomph that you normally had when you were younger. So you come in, you get an evaluation with a nurse practitioner or a PA. We do a comprehensive blood work panel. That blood work panel gives us a really good idea of like what's going on. Not like, it's not the best thing ever because it's just a one-time thing, but we'll get the results of that. We'll do an in-body scan to see what the patient's body composition is. And then our medical doctor will evaluate that and come up with a plan for the patient, which usually has options, which I love because, hey, if you want to be super aggressive and do this, this, and this, or if you want to just try this first and see how it goes. And then there's a follow-up, usually blood work panel within 3 months to see how everything looks. We monitor patients, weight loss, because most people come in, they want to lose weight or maintain weight loss. They want to feel better. They want to feel energy. And these new GLP-1s are very effective for not only weight loss, but as an anti-aging tool.
And tell me about that. GLP-1, what is that?
GLP-1, so, the probably the most common is tirzepatide. So if you have diabetes or pre-diabetes, you get it through your primary care doctor, fine. But for people like us that, hey, like I want to, keep 10 pounds off and like feel, I want to experience how this feels. And
is this a peptide?
Yeah, it is a form of a peptide.
Okay.
And it's prescribed, by a medical doctor. Don't get that stuff online because there's no third-party testing for these online pharmacies and there's no prescription.
Yeah, and I don't want you to, I want to talk about that specifically in a minute, but continue.
Yeah, so then, a doctor doses it and you take it and, if it's too low, then he increases it. If you have some nausea, he decreases it. But we follow a patient and we watch them lose weight and they're very happy and they keep the weight off. Do they have to stand it forever? No. We can microdose it for a period of time. And then hopefully by the time they've reached that weight loss and it's sustained, they can keep it going by practicing the things that they need to, like their diet gets, they change their diet up, they're continuing to do cardiovascular work, they're working out, they're eating properly. Those things will keep the weight off.
So let's talk about this real quick. And you mentioned it, and I want to cover this, Phil, because this is powerful. I think it's important. I certainly have been in a situation where, you're on your phone, you're looking at stuff, you see something you're like, oh, I love that, and you buy it, right? And it comes, how many times have we've all done that, right? It's just part of the deal. But when it comes to stuff that you're putting in your body, that's different, right? It's very important. Buying a pillow or buying shoes or buying whatever, that's one thing, but something that you put in your body is different. So Phil, I want to take a minute and I want to talk about what that looks like, because there's a lot of people out there that are talking about a lot of things. They're selling supplements, they're selling different, online peptides, whatever it is. What does it look like to say, how do we really filter out and what are the negatives? So somebody goes online and advises them, they don't know where it's coming from. What are some of the challenges as to buying something like that, putting it in your body? What's the concern? What's the real risk?
Okay.
In a lot of ways.
I have a couple good analogies for you. Imagine having a sore throat, walking into CVS and saying, hi, can I get a Z-Pack? What are they going to say to you? The pharmacist is going to say, okay, you have a prescription? And I'm like, no. Then I just get in there and I think, go see a doctor, get a prescription for it. It's not an over-the-counter medication, right? We agree on that. Why is a peptide different? You need a prescription from a doctor. You need to make sure that it's not going to have a negative effect. You need to know what the dosing is. These are prescription medications. And if you go online, like I said, there's no third-party testing. You know what you're getting. And it says on the bottle, literally.
When you say third-party testing, what do you mean by that?
So like, let's say we own a pharmacy, okay? We're making a medication or, a product. We send that out to a testing facility. That's all they do for the purity. They're going to test it. You're 99% purity. It's all good. That batch is good to send out.
And when you say the purity, you're talking about, explain that to me.
Like what the product is. So if it's tirzepatide, they're making sure that it's actually tirzepatide. There's no contaminants in it. No,
okay.
Things that it shouldn't be, and that it is what it says it is. Like if it's 8 milligrams per vial, then that's what it is. It's not 6 or 12.
Okay.
So
not all, we'll call it sellers of this information, of peptides and other things, are sending this out for third-party testing.
None of them are. The ones that are not a 503A or 503B, or if they are, they're doing their own thing. They're not doing it under the guidelines of a 503A or 503B compound pharmacy. But here's what's even better. They're going to send you the bottle and it's going to say research purposes only or not for human consumption.
Wow.
Which is, and I talked about with Leo before, is that this isn't so much a warning. This is like literally like it absolves them of any like legality issues.
Wow.
Isn't that kind of crazy? Like you're gonna inject something like that? Like,
so they're sending you something basically saying not for human consumption. So it hasn't been researched at all.
Well, it has been, but not the way they're selling it. They're not doing it the right way. So I think eventually.
So what is the right way?
Go to a place like ours or come to Basis and get prescribed the right way based on like your blood work and exam finding, your urine body scan, what you're presenting to the nurse practitioner with, and then get it sent to you from a compound pharmacy that's a legitimate compound pharmacy where they're doing 503A and 503B testing, and get real stuff and be monitored. Yeah, that's the right way to do it. You're putting this in your body.
All right, so let me ask you this question, Phil. In relation to taking something that's been, we'll call it researched well.
Okay. Yes.
So that way you know what's in it.
Correct.
You know, you said 501B or
503A or 503B compound pharmacy.
Okay, so they're researching it to know what the substance actually is. They're testing it to make sure it's legitimate and right.
Right.
And in your opinion, now what happens is you have the ability to really test and see how it's affecting your body, right? And you can feel more comfortable taking it.
I would think right? So. It makes sense.
Yeah. Okay. So in your opinion, like, what does that look like for most people that you've seen? They come in, they're like, man, I'm a little bit out of it. I don't have the energy, whatever. Somebody's watching this right now, and they're seeing all this stuff online, and they're like, oh my gosh, I wasn't sure what to do, how to do it, whatever it is. Like, I want to get back to my normal. I want to get back to my energy. I want to get back to living life to the fullest instead of just kind of coasting.
Sure.
Like, what's a time frame for somebody? 3 months, 6 months, a year? Maybe it's monitored. I mean, what can people expect?
I like to break it down into like 3 phases, if you want to call it that, or 3 different options. So you've got your hormones. So we call that hormone replacement therapy. That testosterone for men, for women, estrogen, which we monitor estrogen for men too. We want to keep it, we want to reduce it a little bit if you're on testosterone, but women that have progesterone. So you have your hormones. So hormone replacement therapy. Then you got the GLP-1s if there's either a weight loss concern or if you want to just manage your weight or manage your cravings. Okay. And then the other side, you've got peptides. There's a lot of different peptides. So some for weight loss, putting on muscle, skin, hair, sleep. I mean, there's different peptides for different things. So to not confuse it, it all depends on like what you're presenting with. So if someone's like lethargic and tired and not feeling themselves, look at your hormones first. Balance those out before, because if you're on peptides, like you'll hear this sometimes. They're taking peptides, they still feel crappy. Well, are their hormones balanced? Start with your hormone therapy first. Get a good foundation, and then you can do these other things.
And in your opinion, I mean, obviously we've talked about this before off air, but these hormones that you're taking, I mean, it's very similar to what your body already produces.
Bioidentical hormones. You're absolutely right.
What does that mean?
That means, well, testosterone. It's not not saying anything bad about the medical society, but
no. The reason I asked that, Phil, is because this is something that I think people have had questions about in times past. Like, okay, what are you taking? is it actually something that your body makes? Is it, it's not real, it's not what, that kind of thing. So what are your thoughts on that? You said bioidentical.
Yep.
What does that mean?
That's the hormone that your body makes that they've put into either a capsule or a pill or an injectable. It's not synthetic. So there were some like estrogen like creams or like gels that women put on their arms. They found that they cause cancer. It's a synthetic estrogen. So use bioidentical hormones. That's what your body makes, and that's what we prescribe for our patients, and they do great. Of course, we monitor those patients as well to make sure that their levels are within the range and they're feeling better. I'm a patient myself, and I'm happy to tell you my stack. So for hormone replacement therapy, or sometimes we call it hormone optimization therapy, I'm prescribed testosterone, which actually I take what's called subcutaneous, which is a small insulin syringe that I put anywhere with a little bit of fat, and I don't have to do an intramuscular injection once a week. So I take 3 small injections of testosterone a week. And then I take also something called Pregnil or HCG, which increases my natural testosterone making ability in my body. And to keep my estrogen. So when your testosterone goes up, your estrogen sometimes can follow up a bit. So I take something called anastrozole to keep my estrogen at a lower level, usually around the 20 to 30 range. That's my hormone replacement therapy stack. Then I've been taking something called tesamorelin, and that is actually an FDA approved peptide that helps increase something called IGF-1, which is related with growth hormone. And I definitely feel, since I've been taking it, I've noticed a difference. I've actually put on a little bit of muscle. It's a good thing to help burn body fat as well. It's a great peptide. It's like a better version of Sermorelin, which is actually a peptide that's been around since the 70s or 80s, and they gave this to children that had low growth hormone levels. Now they just give them growth hormone. But anyway, and then another thing that I take is tirzepatide, which is a GLP-1. So it's a GLP-1 and GIP. And the reason I take it is not to lose weight, but to help manage my weight loss, is to help just keep my weight where it is. And more importantly, I don't like having cravings after dinner. Also, I don't like eating a big meal. So it helps me not eat as much at each setting. It keeps me fuller longer. And then it really also just gets rid of any craving afterwards. So it's wonderful. I don't drink very often. I don't have a drinking problem. Like I have like 1 or 2 drinks a year. Like literally that's how few I have. But on tirzepatide, I even want to drink less. Like if I start a drink, sometimes I don't even finish 1 drink. So that's pretty much my stack, as well as, take multivitamins, minerals. I'll do occasional IVs. And I do also take NAD, which is a subcutaneous injection, 100 milligrams or 200 milligrams a week. I've been doing that for a little while, and I feel like that helps me with energy. It's a metabolism peptide, and it works great.
And talk to me about this idea of, as far as how long you're on this. I mean, is it kind of like, hey, you're doing this for life now? Is it?
Good question. So the hormone replacement therapy typically will last a period of time. I'm assuming when let's say you start in your 40s, you're probably not going to keep doing it when you're 90, like maybe, I don't know. But your hormones just don't improve over time. Like the peptides are probably something you can more, like we call it cycle. Do them for a few months, you can go off it for a period of time. The GLP-1s definitely, I don't think that's something you stay on forever. You just do it for a period of time. You can microdose it at a certain point, and then you can get off those too. So no, it's not like a forever thing. I do think that testosterone, unfortunately, because I've actually gone off it myself for a little while to see what happens. And yeah, my body doesn't kick in and start making it again.
You feel the difference?
I absolutely felt the difference.
Yeah. And I mean, I certainly have noticed a difference myself as I've been on it. And I think it's important. Why do you think in America, we spend so much money on health. We spend a ton of money on health, and I'm not going to mention these medications, but you see people taking certain medications for massive weight loss. And now some studies and research has come out that, yeah, you're losing a lot of weight, but it's also eating out some of the bone mass of your body and things like that too. Yeah. And muscle too. So, I mean, it's just like people they want the quick fix, but I think it's important to slow down, take time and say, what is the natural quick fix, or the most natural quick fix possible, right? I mean, why do you think we're in a situation as a country where, from your perspective, you've been doing this over 20 years, kind of the wellness space. Why do you think as a country, people are just in a place where they can't seem to find some of the solutions? Is it because they don't know what's available? They don't want to do the research? Are they just lazy? I mean, what would you say really it is, as you've seen people over the years?
I think recently there's probably like an overstimulation of so much, like, where do I go? What do I start with? And then here's what I don't understand is, like, how is the obesity problem still, it's like worse than ever?
Yeah.
How is that, like, with so much information out there? But let's face it, like I said, the foods are, go to the grocery store. Like, what do you see when you go to any grocery store? Just like boxes and displays of foods that are were really not healthy for you. You know, so we talk about whole foods. Eating whole foods are like literally foods that just haven't been messed with. If it's in a box, somebody probably messed with it. You know? So whole foods, you know, eating correctly, but there's all this information online now about what to do. I think sometimes, you know, what's that expression? Paralysis by analysis. Like where do I start? That's why I tell people that want to start. I mean, they want to get an exercise plan. I'm like, just go walk.
Start with something.
Yeah. 15, 20 minute walk a day in the morning. You can do it at night too. Start with that. You're going to start losing weight. Then we can progress to the gym or to doing other exercises, but just like, don't overthink this stuff.
Yeah. Yeah. No, I think it makes a lot of sense. You're right. There's so much information out there today. People are like, how do I get right information, get the right information, and be confident in what I'm doing? Which, by the way, is one of the reasons that I want to do this show. I've known Phil for a long time. And they do a great job. Again, I needed some help and assistance myself. Not because I was in a situation I didn't have energy. I just wasn't optimal, and I wanted to be optimal. And that's really the key. I mean, it's like, you know, if you go to the gas station, I mean, I guess say it this way: if you're going to go to the gas station, why would you take the time and fill your car, stop and fill your car half full? Like, let's fill it all the way. We're already here. It takes another 2 minutes. Like, let's fill it all the way, and you get double the miles when you're driving. You know, it just makes sense. Share with us maybe a story of someone, a great success story, someone that's coming. You don't have to name their name, but the situation, you know, what their challenges were and what the kind of end result looked like.
Okay. So a lot. I've had a lot of stories over the years, but definitely like I've had men that are on the brink of divorce there, and they don't know what's going on. They don't feel this. They don't feel the way that they used to feel. Men go through something called andropause, which is like menopause for women, but it's for men, where their hormone levels go down and they put on fat. And when you have more fat on your body, you release more estrogen. So, and then
Is that right?
Yeah. And
so for men, just pause there. So for men, the more fat on your body, the more estrogen your body can release.
Yeah, exactly right. Yes.
Wow.
What effect on you? I mean, not a good one. We're men. You know, we want testosterone.
Yeah.
So I've seen men come in, get their hormones balanced, and start feeling great. Their marriages improve. And then what I love too about the correlation with what we do is that, you know, making changes to your health and making small ones over time will yield really good things down the road. Just like making changes with your finances and making the right investments and being consistent with those things will lead to good things as well. I think there's a good correlation between health and finance. So anyway, and then what happens is a lot of these patients, well, they'll eventually refer their wives to come in. And so we've helped a lot of personal relationships just by balancing people's hormones. It's crazy.
That's awesome. So it's just, you know, begin with the end in mind, have a journey of where you want to go and pay attention to it. I mean, it's so, we see it so often where people are in a situation where they'll be successful, or at least in the past, I've seen this. You know, I've been in my space, the financial and tax space, for 26 years. And in the past, you've seen a lot of people like kind of give up their health to chase money. And then they get money and they're trying to kind of use the money to kind of buy their health back in many, many ways. Now, obviously, I think that the tables have changed. It's interesting how a lot of entrepreneurs now, my sentiment is, are healthier. You know, they tend to be healthier. They're doing their thing. They're kind of more in shape, you know, whatever. I want to ask you this question though, because you not only have you helped a lot of people, your team, you and your team have helped a lot of people kind of recover, get healthy, kind of meet and achieve goals, but you're on the health side, but you're also in a situation where you have, you know, at the same time, you built a successful business. You built trust. You know, you built trust from families. What do you think from your perspective? You're talking to the viewers out here that maybe have a company, they're building a business, maybe they have a successful business, maybe they have an idea to get started. I don't know where they are on the scale, but from your lens, what's one or two things, Phil, that you would say that this is really important as a business owner to be able to build trust with your potential clientele?
Okay, well, first off, go back to the business concept is that the good thing that I like that when I look into like hormone replacement therapy or anti-aging, it's not going anywhere. And there's more and more money being spent on this. So to me, that's a good business to be in. Of course, there's a lot of competition, but just so doing the right thing, being there for your patients, building, like you said, building the trust, providing good services, providing good employees, good locations, clean, friendly people, is a good way to get referrals, get your name out there, and eventually, you know, be more successful. I mean, I think it's a great thing to be able to offer that as compared to doing it the wrong way. If you're not doing it the right way, and your people are upset with you, and that's not a good way to run a business.
Yeah, and I mean, that's one of the things I've noticed every time I've come in to your places. Your team is happy; they're happy to be there. You know, and that shows. It shows that you're paying attention to the details. So if you miss some of that, we'll call it the other Dr. Phil said is, pay attention to the details in your business. Add value to your families, add value to your customers, be in a market that's a growth market, be in a place where your employees, you provide a nice, clean, comfortable environment for them. You're paying attention to that. Could be little things. I mean, it's just as far as the way your space looks, your office looks, just pay attention to those details. And customers will know whether or not, if you're not willing to invest in your own business in such a way that you feel good when you walk in there, they're going to see that. They're going to know that. It's just kind of the vibe and the feel is going to kind of overflow in a lot of ways, I think, right? All right, let me ask you this, some final takeaways, one or two things here, Phil, from your perspective. Somebody's watching this, they're not optimal. Let's give them real simple, basic. Obviously, you're going to say go to Basis, which I agree. They do great. You guys do a great job. But realistically, what's one or two things that people should be thinking about as they're looking at their life? Because I think, by the way, if you spend time focusing on your health, it will ultimately reflect, if you're intentional, in helping you build your wealth, whether that's build your company, build what you're doing, be more intentional. You're going to be more focused with your brain, the whole thing. But what are some suggestions that you would have, one or two, as a final takeaway for the people watching this? Say, these are some things that I would recommend. I mean, gosh, you're 56 years old. You look great. You look like you're in your 40s, early 40s. You really do. I mean, you've nailed it. You've achieved your goal yourself of helping people look 10 years younger. You've done it. And so, it's to me, it's like one of the things that I love. Your biggest sales pitch is you're living it. You're not just doing it, you're living it. So what's your suggestion to some of the folks watching this that want to do the same thing?
So two things I would say, if you want to get started, is go get a comprehensive blood work panel. See where you're at. If you don't know where your numbers are at, so that's number one. And then number two, no matter what, you've got to exercise and work out, because that's matter of fact, I have this funny saying with my patients. I'm like, you want to know what drug I take? And they look at me like, was he this guy crazy? I'm like, the gym, that's my drug. Yeah. So working out, exercising is going to be the best anti-aging tool. Forget peptides, forget hormones. That's your base foundation. And then of course, what you eat. But if you're serious about your health, work out, eat good, that's still your real foundation. But then, you've got your hormones that you can balance. You've got peptides out there to help you. You've got GLP-1s to help control your weight or lose significant weight and keep it off. And it's a great thing. I mean, there's some really cool things out there to help people.
Yeah, it's a beautiful thing. Well, Phil, listen, thanks for taking some time. Thanks for sharing your thoughts. Thanks for kind of giving some buyer beware. I appreciated you sharing your wisdom on the show.
Thank you. I appreciate it.
You're welcome. Listen, guys, as you're watching this, health is no joke, right? We go through this journey called life one time. So I want to challenge you to really be intentional and thinking about what you're doing with your life. And if it's not Phil and Basis and his team, find someone that you trust. They do a great job. But be in a situation where you are intentional with your life, intentional with really getting to where you want to go. I mean, my gosh, if you don't have a lot of big goals, start setting some. One of the greatest ways that I've found in my life is to find increased purpose in life is to chase after something that's bigger than myself. The only way that you can do that in many ways with the kind of capacity, the intellect, the energy, and the ability to accomplish those goals that you need to have is by getting your health right. So take time to do that. Don't just go home, sit on the couch, scroll on your phone. Be intentional with your own life. I got to tell you, I guarantee you and promise you that the results will be that you'll be more energetic and excited about the journey called life that you're in. Listen, be blessed. Share this show with someone that needs to hear it. And we'll talk to y'all soon. See ya.